My name is Katja Weisel. I'm from the University Medical Center here in Hamburg-Eppendorf, Hamburg, Germany. And at this year's EHA meeting, I presented data of the comparison of ciltacabtagene autoleucel or cilta-cel in CARTITUDE-1 versus standard of care in triple-class exposed multiple myeloma patients in clinical trials of daratumumab. So CARTITUDE-1 was the pivotal trial investigating the anti-BCMA CAR T-cell treatment with ciltacabtagene autoleucel or cilta-cel in highly pretreated patients with relapsed and refractory multiple myeloma. However, as CARTITUDE-1 was a single-arm trial, we have no direct comparison to this CAR T-cell treatment with standard of care regimens. And what we did in this analysis is we took a cohort of triple-class exposed patients out of the daratumumab approval trials and compared the outcome of those patients with the CARTITUDE-1 study cohort. And those comparator patients came out of the POLLUX trial investigating daratumumab, lenalidomide, dexamethasone, the CASTOR trial investigating daratumumab, bortezomib, dexamethasone, and the EQUILEUS trial investigating daratumumab in combination of standard of care. And those patients had then a follow-up, and we looked on the outcome on the line after they dropped out of the daratumumab trial. And so this was kind of a complicated comparison from the statistical point of view, but adjusting the populations to make them really comparable was possible. And we could show that analyzing the overall response rate, cilta-cel showed an observed response rate of 97.9% compared to 37.8% for the observed response of the standard of care cohort. And also for complete remission, cilta-cel was highly in favor compared to standard of care. Regarding survival outcomes for patients treated with standard of care regimens, the median progression-free survival was 8.05 months for an unadjusted and 5.6 months for a closer adjusted cohort. And for cilta-cel in this analysis, the median was just reached at month 23. Also, regarding overall survival, we had a clear outcome in favor for cilta-cel, and this was not reached in the median overall survival for the CAR-T treatment, whereas for standard of care, looking on different adjusted or unadjusted population, it was between 11 and 16 months. So overall, ciltacabtagene autoleucel demonstrated a significant improvement for overall response rate, progression-free, and overall survival compared to standard of care over all analysis conducted, including several sensitivity analysis we did. So what does that mean? Ciltacabtagene autoleucel is a really promising CAR T-cell construct, which is now investigated in a real bunch of clinical trials ranging from early relapse to refractory disease, and trials comparing cilta-cel with standard of care in first-line myeloma treatment are on the way and expect to start early in 2022. Now we face an upcoming approval of this CAR T-cell therapy, and those analyses we conducted show clearly how important this novel construct will be for our patients. And with this superiority, despite the limitations of an indirect comparison, we have a clear responsibility to bring together this construct in a safe and robust and broad manner now to our patients all over the